Good morning, viewers. Today we've got Kathy here, who's had a knee replacement. It is week 7 now and she's looking very good. Bend your knee up for me, Kathy. You can see she's struggling a little bit, but we've got more than 90 degrees flexion, which is the most important thing that you need to get in the beginning. So usually you're not allowed to leave the hospital until you've got 90 degrees bending of the knee and being able to climb stairs using crutches. So the other thing that you're wanting to make sure that you get loose is your scar, because if you bend the knee up, the scar is the section that is going to prevent you from going further. So you'll feel it pulling on the top here, you'll feel it pulling on the bottom there. So you have to, as the patient, work that scar until it is loose, 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 loose. And Kathy's been doing that religiously. And you can even do it in a bending position where you're then going to massage that scar loose, because it has to be loose like the surrounding skin, otherwise you're in big trouble. Now, the biggest thing that I find with most of my knee replacement patients is in the beginning, they've got no pain in the knee. The pain is all sitting up here in the thigh and down in the calf. Agreed? Agreed. Agreed. So you need to do TLC for that area. So you have to go in and massage it. Now, if you've got somebody that can massage it for you, wonderful. If not, you have to massage it yourself. And if you can't do it with your own hands, you can take a rolling pin and roll it like you do dough. Just don't go too hard because you will bruise it. So you're just going to go in there, lots of TLC, lots of bending of the knee, lots of massaging of the calf, and lots of stretching of the calf. So your homework would be in the beginning, it would be your calf stretch, which is that one that we've mentioned several times on other videos. It will be your quad stretch. Now, you're not going to be able to grab your foot up behind you and stretch it. So you will need to sit on a chair, get your leg behind you and under the chair so that you're bending it in the front, massage your thigh as you go along, and you can even at a later stage stand on all fours on the bed where you got your knee bent and then rock forwards and backwards. That works quite nicely to get the knee mobile. So remember, scar, massage the muscles there, because your calf is going to be very tight, your thigh is going to be very tight, your inner thigh here is going to be very tight, causing a little bit of a bubble over here. Your knee will be swollen. That is normal. It'll be swollen for quite a long period of time. Don't panic about that. It will go away as you start moving more. It is vital to walk with 2 crutches, and when you walk with 2 crutches, you're going to walk as if in the army. So left, right, opposite arm and leg, not together step. Together step, don't do that. That's a waste of time. So it's going to be opposite arm and leg. It will make you walk a lot faster. And when you walk a lot faster, you get fitter and the knee is able to work better. So opposite arm and leg. At about 6 weeks, you will reduce it down to 1 crutch. And then the reason why we go down to 1 crutch and not no crutches is because you need to make sure that you're working properly or walking properly and not walking like a spastic person that's going to waddle from side to side. So you go down to 1 crutch, and the crutch is always on the opposite side of the leg that's affected, because you want to continue walking as if you're in the army. And then from there, it will be no crutches. And you will loosen up the leg, and it should be feeling a lot better once the calf is stretched out, the thigh is stretched out. You can even stretch out your shin a little bit by pulling your foot down, feeling it there. But you have to get full knee range of movement, so you have to make sure it goes straight when you tighten it. So that's the other thing you want to do, is you want to activate your quads. So tighten our quads for us, please, Kathy. And you can see it's if she's doing it with a good leg, the heel will lift. So pull it up nicely so that the heel lifts. That's it. You're aiming for the heel to lift. And if you do this one here, tighten it, the heel won't lift yet because it's only 7 weeks, but it should start lifting soon because she's able to sit and straighten her leg over the edge of the bed, which is meaning that we're going to get it there. So those are the first things that you can do for your knee exercises and that to loosen it up. But the massaging and releasing these muscle spasms in the thigh is key to be able to get you to walk and stretch and move so that you can do the exercises. If there's too much muscle spasm in here, no matter how many times you try and do your exercises, you're not going to get it right because it's too painful. So massage it until it's feeling better, and then you will easily be able to do the exercises. So like this channel, subscribe and send it to your friends and family, and good luck with your knee replacements.